think stem cells can be applied in almost every situation where we have degeneration, where we have damage, injury, that kind of thing. The number one thing I usually inject stem cells into is the knee for osteoarthritis. I get a lot of patients who come in with knee osteoarthritis, sometimes bone on bone, and they don't want to have surgery. A knee replacement is a good surgery. It's a very good surgery. It can extend life and make people more active again, but it's not 100%. Just like everything else, it's not 100%. And what I found in my experience in my orthopedic practice was that about somewhere between 40 to 45% of my patients who had total knees were not happy with their total knee. It still swelled up. It still hurt. They can't kneel on it. They still couldn't do what they wanted to do. And I even had, quite a few patients come back and say, Steve, I wish I'd never had this done. Another telltale sign is they'll get one knee done, and then you say, okay, you want to do the other knee? And they say, nope, I'm good. And so then they start looking for other options available for the other knee because they don't want to go through that again. And that's where I have them come in to my regenerative clinic and say, yeah, we can put stem cells in there. With a knee, the success rate with stem cells as far as decreasing pain, improving function, and making them happy is about 90%. And so 9 out of 10 people are happy they had the stem cells done and they didn't need surgery. The real proof is in the pudding, right? They're moving better. So when they come in, I watch how they're walking and I say, yeah, you're walking better. And they say, yeah, oh yeah, my wife told me, or my spouse told me, hey, you're not limping anymore. I'm like, yeah, that's exactly what the stem cells do. And so they have a super anti-inflammatory effect. And then, of course, they reproduce, regenerate, secrete exosomes. They do have the capacity to make some new tissue, but they're not going to make like a whole new meniscus. Just injecting stem cells into your knee is not going to fix the meniscus that you had taken out when you had surgery. Me too. I had the same knee surgery. But what they do is they can decrease the inflammation and stop the inflammation cycle while the exosomes are communicating with your body saying, hey, this is an area that we need to kind of heal and focus on. And so it gets increased healing. The inflammation is down, so the pain is down. You can sometimes get a small layer of what's called pseudo tissue or pseudo cartilage that the stem cells will create, but it's usually not a whole lot. But I tell patients, it's enough so that you feel better, and you can move better, and you can still do the things you want to do.